When a client comes to see me for a colonic hydrotherapy treatment, I go through an extensive medical history form. So we need to go through their health, what supplements they're taking, what symptoms they might have, and understand the purpose and what they want to get out of their treatment. I then take their blood pressure just to make sure that they're all fit, well and healthy. If someone's got high blood pressure, then I certainly wouldn't treat them, and I'd recommend they go back to their doctors. And then if someone has low blood pressure, we just to make sure that everything's all okay and they don't get dizzy after a treatment, because you are actually lying on the treatment bed for over 40 minutes. After I've done that, I leave the room and the client can either slip their bottom bits off or they can change into a gown, whichever they feel more comfortable in really. They then lie on the bed with a towel draped over them loosely like a blanket. When I come back in, I then feel their abdomen, and the reason I do that, I'm checking for wind primarily and to see how full they are, and also if they're tender in any area, because then that way it gives me an indication of what's going on. I then have to turn them on the side because I have to do a digital, not the photographic kind, I stress. The reason I do that, I just check that everything's okay down there for their bottom. I have to check for hemorrhoids, anal fissures, which are tiny little tears in the bottom, and also for gentlemen of the more mature variety, enlarged prostate. Then what I do is I insert a sterile disposable plastic specular. It's about 1.25 inches in length that goes into your bottom. It's lubricated. It's not painful, but it is an alien sensation, and I always think when I have my colonics it feels like you're doing a poo in reverse. Then I attach 2 tubes. Now behind me is the equipment that I use. Contrary to what people think, you are not going to be on all fours with a funnel up your backside, and there is no hose pipe that is shoved into your colon. The first one is water. Warm, purified, filtered water that will go into the colon. It's going to hydrate and then it's going to gently loosen the fecal matter. The other thing is, I'll see everything that is coming out. So if you visualise a casserole dish left in soak, a burnt one, then you can perhaps get that image of what happens. So the warm water goes in, hydrates, gently loosens, and I'll see what's coming out. And then from there, I can give you the appropriate advice. The other tube that I attach takes everything away. You don't see anything, you don't hear anything, you don't smell anything. I'm not at the bottom of the bed sieving it, I don't weigh it, and I don't reveal samples in takeaway boxes afterwards. There's none of that. You're on your side, and then I'll turn you over on your back. Your sensations during your treatment feel a bit like butterflies in your bottom because of the warm water going in, and the feeling you're going to the toilet without having to push. So it is slightly unusual. But the duration of your treatment, all we do is chat, and I can chat about anything.